Hello everybody and welcome to this edition of Virtual Coffee with an OSCE Educator. My name is Sarah Grant. I'm the Managing Director of My Healthcare Recruit and owner of OSCE Accelerator, and we are joined today by the lovely Beth Fincato, who is one of our OSCE Accelerator advisors, and Beth has been teaching OSCE for over 5 years to literally thousands of international nurses and is a wealth of information. So we are delighted to have her with us today. And because we get so many questions on our social media about the OSCE, about different stations, we really wanted to do a slightly deeper dive today into the in-hospital resuscitation station, just so you know what to expect and how best to prepare for it. So Beth, welcome. Let's dive straight in. So we're at the in-hospital resus station. What can an international nurse expect to be presented with?
Okay, so for this station, you're normally given the following scenario. Actually, I haven't had any nurses who've had a different scenario. So it's normally you've gone to another ward or department to borrow something and you find a patient collapsed. So you don't know the patient. And then obviously you have to conduct your initial assessment, check for breathing, call for help, and then continue with your chest compressions.
Got you. So how long in all in total for this station?
So it's 6 minutes. I know that sounds really fast, but when I've been teaching this, I'm not even using the timer because everyone is finished before then.
Okay, so don't stress too much. Wonderful. Any documentation required at this station?
So no, you don't know the patient, no documentation.
No documentation. Guess that makes it a bit more straightforward. What equipment might you be presented with at this station?
So you'll have a resus mannequin. It's important to know for this, it's going to have like a monitor attached to it, which is going to measure your compressions, you know, how deep they are, the speed, that kind of thing. You're not going to be able to see this monitor, but the examiner is going to check it afterwards. So in between your cycles of compressions, they might give you some advice like go a bit faster, do them a bit deeper, something like that. It's very important to listen to these because they're trying to help you.
Got you. Okay, that makes a lot of sense. And how would you recommend that an international nurse best prepare themselves for this station to put themselves in the best position for passing?
Okay, so it's very important you practice your compressions, so you're doing them at a good rate and depth. So remember, your rate should be 30 to 2. Depth is 5 to 6 centimeters, and the speed is 100 to 120 a minute. Also, make sure your assessment on the patient is done well and you know exactly what you're going to say.
Got you. And so, would you say there's any reasons for common fails, common mistakes at this station?
So the one I've encountered, the main one we've had for people failing is the compressions, poor compressions. So that really needs to be practiced as best as you can. I know you might not have access to a mannequin, but just try on what you can on a pillow or whatever. I
was going to say, will a sofa cushion do?
Yeah, I had one nurse who practiced so many times she broke the mattress.
Wow.
I might not advise that, but
sounds like dedication. She passed, absolutely. Any top tips for this station then, other than potentially practicing on a mattress?
Yes. So make sure you're clear of what you're going to say when you call for help. So you need to make sure you're very, very clear. Pretend you're talking to someone who doesn't have a clue. Don't imagine you're talking to another nurse. Okay. So say, can you call for adult medical emergency team on 2222? Come back and help me and bring the crash trolley with you. Also, as always, practice with the marking criteria and get someone to assess you if possible.
Wonderful. Where do you think this skill ranks then in terms of hard to medium to on the easier side?
I'd say it's probably medium to hard. This is quite often ones people are failing, but we do have some nurses who have a lot of experience with doing this procedure and they pass it really well. So don't get nervous, just try your best and you'll be fine.
Practice makes perfect.
Yeah.
Wonderful. Well, thank you so much for joining us, Beth. Much appreciated. And we look forward to you joining us again next time.
Okay, thank you.
Thank you.